Thank you for inviting us to talk at ISTAP for our first responder skin tear pack. We are here to discuss the prevalence of skin tears and a prevention action that we took to assist in recognizing this issue around the world. Today, we have with me Annette, who's the Head of Governance and Risk at Heritage Care, and I myself, Dr. Chloe Jansz, is the Director of Healthcare United. And we're going to have a chat with you guys today about how we really looked at and also attended to the skin tear issue. So in disclosure, Century Medical manufactured and supplied us with the skin tear pack that we used. Healthcare United holds the trademark, and we also have to pay recognition to our colleague, Professor Dr. Sonia Cleary, who also worked on the skin tear pack, who's from RMIT University here in Australia. The learning objectives for today is the development and the purpose of the skin tear pack, the clinical utility and efficiency of the improving the first responder outcomes when managing a skin tear in the aged care environment, the skin tear healing outcomes, and the cost effectiveness of this. We'll also discuss the feedback from users and the benefit of education and reducing the management of skin tears. So why the skin tear pack? How did we even come to this position? So if we want to recap about the skin, so we know that when you've got young skin versus elderly skin, anyone over the age of 65, you can see that epidermal layer is reduced. You can see the thinness of the skin and therefore the exposure that our elderly population has in terms of the risk of getting a skin tear. We know mechanically their range of motion from their ankle, their flexion extension, their edema or their fluid retention that they may carry causes their ability to ambulate correctly to be impaired. We also know that once they get a skin tear or a break in the skin, that we can see the vasculature of the lower limbs and also the collagen to help stitch the skin back together is also impaired. And so prevention is the key. However, in aged care, to prevent skin tears is almost impossible because the reason for a resident being in aged care is because they are impaired, whether it be cognitively, most of the time it's the ambulation and their safety to why they're needing 24-hour look-in or care. And so we have to really come from a place where we have to respond correctly first to make sure that the skin is supported and to make sure that the wounds don't become chronic ulcers. So evidence to the prevalence of skin tears currently, it's a huge breadth of knowledge and a huge breadth of prevalence status that between 1.1 to 41.2% of people will get a skin tear in aged care. And so it really depends on their medical history, and it really depends on their environment, so the stimulus and how they can have a fall and if there's enough room to ambulate, etc., to why this statistic is so large. In terms of the evidence to the skin tear pack specifically and why we were looking at once you have a skin tear to support the skin, it really came from Sarah's study in the International Wound Journal, where you can see I've highlighted it in bold, that adopting the correct technique during the skin care prep of skin tears, it's a bit of a mouthful, is to reduce and avoid the severities of what can happen if that first correct technique and that first correct response is not done properly. So as you guys will know, and I'm sure during the presentation sessions today, the skin tear definition by ISTAP and was made by LeBlanc's team in 2018 will be said many, many times, but it's a traumatic wound caused by mechanical forces, including the removal of adhesives, and that severity may vary in terms of depth, but that is what a skin tear is. We know the classifications, and we adopted these classifications when looking at our first responder pack. So the purpose of the skin tear pack in aged care in the community. So the study's aim was to look at a unified first response to skin tears to see if we could adopt a method that was then going to help prevent skin tears becoming chronic, but then also who can do that skin care to the skin tear. So is it only a regulated health worker, so only a registered nurse, enrolled nurse, or nurse practitioner? Or in actual fact, can unregulated workers such as personal care attendants, the consumer themselves, or carers be applying the skin tear pack? For the purpose of our study, we looked at the unregulated worker personal care attendants, and then we also looked at registered nurses and enrolled nurses. So the contents of the pack, inside the pack, it comes as a usual dressing pack. So with your non-woven gauze and your dressing pack, it comes with a calcium alginate to stop bleeding if required, and then a silicone foam dressing as well. Comes with the usual forceps that you would use to clean a pack. It doesn't come with a cleanser because we thought in aged care there's lots of different cleansers and availability of cleansers. Same with gloves. We did this study during COVID, so there was lots of infection prevention in terms of gloves, etc. So we didn't include those in the pack. The difference with the pack was that it had clinical education with it. So you can see that it had the ISTAP guidelines of how to look after a skin tear, and then flipping over, it had the documentation. So it had what type of skin tear was it, what then to use based on the skin tear, where on the body is that skin tear, and have you taken a photo, have you done all of your documentation for the place that you work? And at the very bottom, you can see there's also a ruler there to be able to measure that skin tear correctly. You will note we didn't put steri strips or closure strips in with our skin tear pack. In Australia, we have a protocol set out by our Department of Health in 2022, which said to avoid skin closure strips and sutures. And as per the ISTAP definition, the removal of adhesives can cause skin tears. So hence why we don't practice with steri strips in our practice. I'll hand over to you, Annette.
Thanks, Chloe. So what did we do? Well, we had to collect some information first and foremost from the cohort to understand where we were. So we had a look at the data across the sites for the organisation I was working for at the time as to the prevalence of skin tears, the types of skin tears that were experienced by our clients, how those skin tears were obtained, of course, how long it took to heal, the dollars, which is always important, how much we were going to potentially cost save. And then we looked at the different, as Chloe mentioned, the different types of health workers that we had. The predominant volume of healthcare workers in the aged care space in Australia are unregulated healthcare workers. So it sort of made sense to look at whether they could be a key player in the management of skin tears. To do so, we had 4 sites involved in the process. They were named North, South, Rural and Central. And for each of those sites, we gave them a different set of instructions and equipment. So our northern site were given the skin tear pack and some instructions, but we didn't give them any education. Our southern site was given education just in relation to the skin tear pack itself. So here's the pack and here's how to use it. Our rural site, though, we went a little bit further and we actually gave them some comprehensive information around the management of skin tears, skin hygiene. We also looked at a bit more in-depth knowledge just in general about management of skin. And then, of course, the skin tear pack education. And our central site was their control arm, and we didn't do anything. We said, here's the equipment, guys, and we popped it in their cupboard and left it up then to see what would happen. Sorry, Code, go on. What was interesting, I guess, when you have a look at the stats that are up on your screen now, is prior to implementation of the skin tear pack, we had quite a significant volume of skin tears. In fact, in that graph in front of you, prior to, we had 637 skin tears. Post the implementation, you can see we actually had a decrease in skin tears in general. There were only 237 recorded during that period of time. The assumption in this place is certainly in this space was using the pack. We had an overall reduction in skin tears because there was actually a bit more knowledge around the management of skin and older persons. Why? Well, why do we have skin tears? Well, certainly there's 4 key areas there. Our residents fall, unfortunately, and quite often as they fall, there is damage to their skin. Self-inflicted skin tears often occur because someone bumps their leg on a piece of furniture or might knock an arm on a kitchen table or something along those lines. Item 3 is the one we're not too comfortable about, and that's the other title. And other is where a skin tear is inflicted, usually through staff practice. So it perhaps is poor manual handling, or a staff are perhaps trying to assist a resident to mobilise and they just hold on too tightly and in effect create a skin tear. And friction generally are related to bed related, or someone's rolling over in bed, or perhaps even manual handling in bed, and we cause a friction related skin tear. As you can see, though, quite clearly falls are the highest risk for our clients to experience a skin tear.
So then we move on to days to heal. So you can see that we've categorized the types of skin tears that the study looked at. So type 1, type 2, and type 3. And then you've got the average days to heal while using the skin tear pack, but then also pre the skin tear pack. So the shaded area was pre the study, and then the non-shaded was post. So we can see that for a type 1 skin tear, before the study, 22.95 days it took to heal that skin tear, where it came down with the pack to 9.91. You can see for type 2, 32.5 days to heal, and then 5.7 days to heal with the skin tear pack. Understandably, the highest days it takes to heal would be a type 3, because there's no flap and there's no viable skin tissue. So that was 50.9, but we were amazed that with the skin tear pack, it brought it to be even less than type 1, so 9.8 days to heal. And if we think about that from a cost perspective, you think about the staff time it takes to do dressing changes, the resources. It's not just about the actual pack itself, but because we're in a COVID environment, it's also about collecting all of the equipment, going in and out of rooms, having to change PPE as well multiple times. You're cost saving on all of that. So in full transparency, you can see up in the corner how we actually got the totals, but it included the time it takes to do a dressing. So it usually takes about 30 minutes to do that dressing twice a week minimum. And then, of course, the dressing pack and what was needed to go in to see a resident to do their skin tear. So you can see before we did the study that it was $20,000, which, we ran the numbers a few times because we nearly died of shock, for those 8 weeks pre the study. For the same 8 weeks over the study, it only cost 2,600 Australian dollars we're talking. So that is an 17,000 Australian dollar saving, which is astronomical to anybody in a environment, especially in aged care, where money matters and funding and all of these things that we get from government bodies. It really matters for where that dollar is spent. If you want to see the full publication of all of this in its entirety, it has been published via the European Wound Management Association in July last year. So please go and have a look, or contact us if you need to. In terms of the feedback from users about the trial and about the skin tear pack itself, I'm going to hand over to Annette to talk about that.
I think the key with any new product, particularly in an environment where we're using both regulated and unregulated users, is hearing from the ground, because there's no point us as experts designing something and rolling it out and then it not working. It's key. I think you'll see from the comments that we've collated on this slide, the general theme was very positive. I think particularly the clinicians and the regulated health workers were positive in the space of being able to use a broader work group, and they understood the relevance of actually addressing the skin tear as quickly as possible because of the longer term potentials of not addressing. So some of those comments: convenience, it was a great idea, very evident, I guess, in some respects. Some of our particularly regulated health workers were a little bit concerned about part of a carer's duties to be doing wound care. So that was a little bit of an interesting exercise to help our regulated care workers understand that there is a place absolutely for unregulated workers to be at the coalface. They're the staff member that may actually inadvertently cause that skin tear. So to be able to action it within half an hour of it actually be, the wound occurring, the outcome is unbelievable for the client. Whereas sometimes if an unregulated worker has caused that injury, it could be half an hour, 40 minutes, even longer before the registered nurse or their regulated worker is able to come and have a look at that wound, make an assessment, design a dressing regime, and then implement that regime. An hour and a half goes by, you've wasted all that wonderful time that could have been addressed initially. But that was some interesting conversations to have with some of our registered nurses to help them understand. But certainly I think it was the positivity, and you can see by the comments there that came out, was probably much stronger than the negativity around it. We certainly had a couple of the unregulated health workers who also then questioned and said, oh, how does this actually fit in my job? And they were so interested to learn and understand the mechanisms behind the skin tear actually incident itself, and then the packet implementation. And they were the ones that were actually coming forward and asking more questions and wanting more information, which was a really interesting finding as well, but certainly not noted on this slide.
And I think it's also important to add your comment, Annette, about the unregulated workers, if they were to cause a skin tear, the fact that they can do something about it to then, I guess, feel better is not the right word, but to take responsibility and onus to go, okay, I may have held a resident too tight or done something wrong, but I'm going to fix it, and I'm going to fix it with the best practice care, rather than feel guilty for maybe causing a skin tear, but then also not like reporting it to the regulated worker, but then being, I guess, anxious about when that regulated worker is going to act upon it. If they could act upon it quicker, we definitely found that they took on that responsibility to, I guess, fix a problem and use use that skill, that new skill, to be able to better care for their residents as well.
Yeah. And I think, Chloe, the only thing I sort of didn't touch on there also was the COVID management component. Certainly within the Australian context, the management of a COVID infection is quite, as is good infection control, but it's quite a regulated lockdown process. And where we have care workers having to go in and out of a resident's room in an environment of every time having to don and doff, to move from room to room to room to room, if they're having to go into a room, ideally recognise that they've made a mistake in not bringing all the equipment required to deal with a wound, and having to leave and doff again and go and collect equipment and don and doff. The pack was just amazing in terms of that space. When a skin tear occurred, it was one piece of equipment that was required. Grab the trolley, bring it to the room. They could deal with that dressing and then leave the room and not have to multiple times don and doff. It was a fabulous, a sideline that wasn't kind of as part of what we were looking for, but it was an amazing piece of additional support for the homes.
So in terms of the overall outcomes of the pack, we pretty much touched on it with the feedback, that it was bringing that onus to the nurses and the unregulated workers to really show that they really cared about their residents, that they were able to assist the resident in a timely manner and really be part of their care. A lot of the people that work in aged care, they've got a real vested interest in the residents, and they treat them like their own family, which is beautiful, and why we want those type of nurses and unregulated workers to be working in aged care. And so the fact when they see someone they care about hurt, it was really good to be able for them to know they've got best practice and they're also got the right equipment to be able to perform that best practice. We also found that having the severe type of skin tear being type 3, where there's no flap, there's no viable tissue, and the greatest risk of becoming a ulcer or a chronic wound, especially if the skin tear happened on the lower leg, where they may have other medical issues happening, such as diabetes or venous issues, that the skin tear pack itself, by responding quickly and having the right dressings and the right management, took that skin tear from a 50.9 day average to a 9.8 day. We haven't even touched on, because the presentation's too short, but we haven't even touched on infection. So the risk of infection, the longer you have an open wound, that we have also prevented that. We've prevented the risk of infection. We've prevented possibly the need for antibiotics and other things that occur the longer a wound stays open. I'll hand over to Annette for the rest of the study outcomes.
Thanks, Chloe. Look, I think speaks for itself. We had such a great time when we were reading some of these statistics, and especially that healing time. I think we, not just with the finances, ran the numbers several times, but we reviewed that data several times because it was just amazing. I think to the point that it's the last point on the slide there, the homes that we supported, or the environments that had the greater education, we absolutely saw a much better uptake of the process, a broader knowledge. To your point earlier, when Chloe mentioned that staff were reporting issues, it actually translated to a little bit more than just skin tears. We noticed that the carers in those particular homes actually started to report to the registered nursing team, to the regulated workers, other issues that they were picking up that perhaps they hadn't reported before. So although it was one small component of care we were looking at, it actually had a much broader range. And so very much when we went back to the sites that didn't have education, and we post the study, implemented some more education, we saw similar uptake and similar results in those sites that were not provided with the education at the outset. I think too, something we haven't also noted on the slide, but just as a process of that, we of course absolutely engaged with both residents and their families. And there was some amazingly positive feedback from families to say, gosh, I remember mum had a skin tear before and it was weeks and weeks and weeks before it got better. How did you manage to do this in such a short space of time? So I think some of the intangibles were really that, you know, residents were able to have a wound, and within a short space of time it was healed. I think the other component too for this, of course, absolutely we touched on, is the dollar savings. As we're all the same, we've all got a limited bucket of money to spend, and if we can find other avenues to spend that money in, which isn't wound care, it's a much better outcome for both the residents and the staff. That's 17,000 doesn't sound like a great deal, but it's an amazing amount of money that we could certainly spend on things within the organisations and within the homes, on things other than just wound care products and nurses' times to put wound care products on.
And on that point, and to end the presentation today, I think residents would much rather have an extra serve of dessert, or even multiple different options of dessert. I know I would definitely, instead of spending that money on wound care. So yes, it's all about bringing it back to the resident, and to be able to not only look at their medical care that they may need in aged care, and also in the community this applies to, but being able to use their funding for other types of health, such as social, which we often forget because we often put medical as a higher caliber. So yeah, it was really good to see that we could do that. So we want to thank you so much, ISTAP, for inviting us and recognising our skin tear pack. We're also very grateful for your own endorsement in terms of using the types of skin tears and the definition that you guys have put together. If you would like to contact myself or Annette at any stage, our details are on the screen. Please feel free to do that at any time to discuss our skin tear pack further, or any further questions. And we'll see you all at the live Q&A. Thanks so much.